Is that okay, Paulo? No. How's that? Is that? Does that sound nice? Okay.
I don't know. Can people hear us?
Can you hear me? No. Is it okay?
Hello?
Hello.
Can you hear me?
I can hear you. Hold the mic.
Me? Or is it okay now?
Yours doesn't sound on.
Go ahead.
Hello?
Can't tranquilize.
Like that? No.
How's mine sound? Hello.
Yeah, I can hear you.
I didn't do that.
Welcome to KT and welcome to our conversation on ketamine assisted psychotherapy. Is this louder?
Louder.
Louder. Right up into the mic. Thank you. I'm Daniel, and I organize MAPS Psychedelic Integration. And for the most part, we hold monthly or bi-monthly integration circles where people get to come and talk about their experiences in a safe and judgment-free environment. And we were approached by Veronika and Greg, and they said, "Hey, can we do this talk?" And I thought that was a great idea, and I guess so did you. I appreciate you all coming out. I know that there's a lot on TV tonight, and the fact that you guys thought this was better, it's very meaningful. It's very meaningful. So I'm glad you're here, and I guess you probably found the website, and so you know the other events that are happening, the circles. There's going to be the launch of a web series next week in Berkeley. Still more volume, huh? Oh, boy. I don't like to shout. The sound needs to go up.
You should hold the mic.
I should hold. All right. Fair. So I would love to introduce Greg and Veronika. They are both therapists that work with MAPS on the MDMA trials and do some amazing things with trauma and mindfulness. And as we know, also they do work with ketamine assisted psychotherapy. And should we clap? Should we welcome them?
Yeah!
Thank you.
So I appreciate you guys coming out. That was a very brief intro. Can you tell us a little bit more about who you guys are and why we're here talking to you?
Yeah, definitely. Thank you so much for having us and having this conversation tonight. And thank you for everyone who showed up. That is really wonderful. And as you said, we are both therapists on the MDMA PTSD trial by MAPS, and I am as well a trauma therapist in private practice. And since last year, I've been working with Ketamine Assisted Psychotherapy. I worked in an infusion clinic, and currently we have a private practice clinic where we provide this type of treatment.
Yeah. And so how do we get into this work? One of the frustrating things about working on a study like the MDMA, you can only do that work with a very limited number of people who make it into the study. And you find yourself in this position of seeing this work that is so healing and so transformative. And right now our hands are still tied by the DEA and the FDA and the illegal nature of these drugs that we all know work. So ketamine offered an alternative, something that we could do now, another drug that offers similar transformative effects for people and can be incredibly healing. And that was something that we could offer to people immediately. So that was one of the draws for doing this work.
What might some of the other draws have been?
Well, there's compelling research to show that it's very effective treatment for depression, as well as some other issues like PTSD as well, and anxiety.
Yeah, exactly. So that it was when we were actually training for the MDMA trials, our colleagues Phil Wolfson and Julian Andrews have been working with ketamine and have been telling us about their experiences with treating variety of conditions. So, the most research has been done with depression, but there has been research with alcoholism, anxiety, PTSD, eating disorders. And, being a trauma therapist and working, with variety of modalities, and then still working with some clients who don't get better and who, what I had to offer wasn't enough. There was really an excitement like, oh, we can offer something different now, what is legally prescribable if people need it. And so that's how, I got interested in working. And I first worked in an infusion clinic where I was developing a Ketamine Assisted Psychotherapy program in addition to the infusion. So all the patients there were being treated for depression. But there were still, challenges with the set and setting in the infusion clinics and with, variety of things that came up. And so that led to working with, Gregory and our 3 other colleagues, which we've all had the same training, kind of following the model which we use in the MDMA assisted psychotherapy.
When I've got so many questions now. So when I was telling people that this was happening, I got basically 2 responses, and one was that they had heard it was a cat or horse tranquilizer, and then the other thing that people mostly said is that they're aware that it's a party drug and that it's used recreationally, and that it's, a lot of people think that that's super fun. How is it different? Well, so how is it different? And how did somebody discover that it was actually good for depression? Because it wasn't created for that, right? It's not technically supposed to be for that, right? It's supposed to be like a tranquilizer, an anesthetic.
Mm-hmm.
So how did it evolve into what it's becoming now?
So maybe say a little bit about a history, and then let Greg to talk about a difference between the recreational use and how we work. So ketamine was developed in the 60s as an anesthetic. It was very safe anesthetic, that there wasn't like a depression of breathing, and so there was a lot of excitement about it. But what happened, there was this thing that they called emergence phenomena. And that was that people who were coming out of the anesthesia had these fantastic experiences of near-to-death experiences, to other lifetimes, to going back to their memories, traveling, what they perceived like other dimensions. And so that was very distressing from them coming from anesthesia. And then as well in the hospitals, the doctors didn't really know what to do, and wasn't convenient for its use. So very soon it stopped being used with adults. It still continued to be used with children who were maybe more undistressed with magical thinking, and as well started to be used in veterinary medicine. So that's why it's known for use with animals like cats and horses.
So people who can't describe magical phenomenon, it's okay. Like animals are people too.
Animals are kids, yes. Mm-hmm.
Yeah, or children. People aren't upset when children talk about magical thinking, but adults do. They really want you to just lay there and be quiet in their recovery room after a medical procedure. So what's different about this versus recreational use? And I would say this applies to all of the psychedelics that we work with, that we know about. MDMA treatment and the protocol is very different than going to a rave and taking MDMA. Same with LSD, same with psilocybin. So when you're taking it with a trained therapist or a facilitator or a sitter, it's a very different experience. All of this work for us is guided by the belief in a person's inner healing wisdom, and that these drugs, ketamine, MDMA, LSD, whatever drug it is sort of the tool that allows a person to really get in touch with their inner healing wisdom. And that part of us that is innate to all of us knows what we need, knows what needs to happen during that experience. So it's very safe, it's very supported. We do a lot of preparation to prepare people before we give them the medicine. For example, in the MDMA study, there are 3 preparation sessions before anyone gets the medicine. With ketamine, we also spend a good deal of time preparing people for this, particularly if they have no other psychedelic experience. It can be distressing to go into that ketamine space with no preparation.
What does the preparation look like?
Yeah, so we talk to people, what are their goals for treatment? What brought them in? What else have they tried? We talk about, do they have other psychedelic experience? We work with them to set intentions. And then we give them some information about what they might expect. We try not to, to lead or to predispose anyone to a particular type of situation or experience, but we try to prepare them. This is what you might encounter. These are some of the common experiences that people have. In particular, the dissociation, that kind of consciousness separating from the body. Some people can experience that as distressing. At higher doses, people can certainly experience ego death or ego dissolution. And if no one's ever heard of that or experienced that, that can be quite distressing as well. So we do our best to prepare people for those sorts of experiences.
But now, sometimes all the preparation in the world doesn't actually prepare you for ego death.
Nothing really does. Nothing does. Yeah.
So talk to me about how the setting is managed and the guidance is managed in that moment when that starts to happen for people, if you don't mind.
Yeah. So it starts with the setting. I think we'll talk about that first. The office that we work in is set up to be very comfortable. Feels more like a living room really than a clinical practice, and Veronika can talk in a moment, kind of contrasting that with some of the infusion clinics. Someone in the audience today who came to our office for the first time saying how warm and comfortable it felt. So that's exactly what we want people to feel when they walk in the door. There's a variety of religious iconography. We try to find a balance between clinical and woo, and kind of walk that line. And then the set, helping people to feel safe, letting them know that they're supported, that whatever comes up in this session is exactly what needs to come up. And again, orienting people to that inner healing wisdom, that part of you knows better than I know, knows better than any of the rest of us know what needs to happen.
Yeah, and it as well, kind of like your question about ego death is, there is as well variety of dosage which we work with, and so that probably somebody most likely wouldn't experience on the lower dose experience that most of our clients will work with. But we talk about, that is one of the possibilities, so kind of preparing the person as much as we can for what they will experience, and and it really starts with the information they hear about ketamine in the media, in the news, from their friends, and it kind of creates that mindset as they're coming in and deciding this might be something what will help me. Usually their doctor or therapist recommends this, or they read about ketamine assisted psychotherapy, and then from the first contact with us, that we want to answer any questions they have, and supporting that feeling of the safety, and that trusting us, our support, but really trusting themselves. Like Greg is talking about it, inner healing intelligence, the inner healing wisdom, and trusting the medicine that, whatever needs to come up will come up. And so that's how we, help people to prepare and support them during the whole experience. We are always there. We never, leave them alone, or if we, went to the, get water, we will let them know. But there with one or two of us throughout the whole experience. There is the medical doctor, which is the one who prescribes the ketamine, who's giving the prescription or administering if we are using intramuscular injection. So there's all of that support.
Yeah, and we're careful not to throw people into the deep end of the pool in their first session. So we start everyone at a very low dose. And some people just stay there for that
ripoff.
Well, depends on how attached you are to your ego. But, we want to ease people into this. We want them to, particularly if they have no experience whatsoever with any psychedelic, we want to create a situation where they can, explore this new space and feel comfortable in this new space, and then gradually titrate up from there.
And then we have, just the variety as well of protocols. That there are people who are coming for depression, the treatment might look like and the dosage than for someone who's coming for treatment of trauma.
I'm really enjoying the inner healing wisdom. You've kind of said it a lot, and it speaks to me. I like that idea a lot, and I sort of like when I feel like I'm in tune with that. And I'm kind of curious, what does it look like when you start to see people over and over again, kind of tune into that and touch that, and then all of a sudden have different perspectives on their life? Because this is one of the things I hear a lot is that, the dissociation allows people to view their patterns. Most of these substances will, right? The dissociation allows them to view their patterns and the things that have been keeping them small or depressed or sad or blocked, and what have you. And then all of a sudden, there's this new part of them that kind of knows what to do about that. And so it's how do we support that?
Gently, tenderly, a lot of love and encouragement. What is it like to see that? I think it's the most beautiful part about our work. And that inner healing wisdom, it's incredibly liberating as a therapist to also I don't have to do anything, not that we don't do anything. But that you're supporting the people through this process all the time. In my mind, you got this, you got this.
One of my favorite articles, it was given to me by a yoga teacher or might have been a psychotherapist, and it was called In Service to Life. And it was talking about moving from the mindset of fixing or helping, which is often the medical model. The Western medical model is I am the expert and I fix you, to the service-oriented model, whereas I serve you because you're holy, because you're sacred, and you deserve to be served. And that sounds a little bit like what you're talking about.
Yeah. Very much so.
Yeah, it's beautiful what you're saying, and that we see ourselves as being of service, and there is this inner healing wisdom. It's the innate ability to heal. So even in the Western medicine, we might think, oh, the doctor comes and cures us, but actually they might clean the wound, or they might give us some medicine that helps our body, but it's our body that is self-healing. And so we are really trying to make space for that to come up in the sessions. And it's not that we are engaging in the process and supporting and joining the client in whatever it's coming up. So there can be variety of things that we might do. It might be a conversation. It might be, physical, like a touch support. It might be, just holding space and empathizing. Sometimes it might be, more intense processing. But the idea is that it's like their inner guidance that we are following. And our job is to kind of get out of the way, to not have that perceived idea, this is what I need to do, and this is what they have to do to heal. So in that way, it's a very liberating and honoring their journey, their wisdom.
Yeah. One of our, I'm often reminded of the advice of one of our mentors, which is wait, W-A-I-T, why am I talking? So whenever I find myself in a situation with a client or someone that I'm serving, and I have an impulse to interject or to, I lose track of my own agenda. It's like, wait, why am I talking? So it's really, like Veronika said, getting out of the way and allowing the person, their process, their inner healing wisdom to really do the work.
Rarely have I regretted saying nothing.
Yeah, and I liked on what you said too, that there is this, it's almost like a paradox that we can think, ketamine is a dissociative and it causes dissociation, but oftentimes what our clients report to us, they're like, oh, I can feel like in my body, like I feel embodied for the first time, I feel connected, that actually they dissociate from things that keep them from being truly themselves and connected with themselves. So it's these protective mechanisms or, fears or ways that are standing actually in the way of being fully present. And, that's something what, I've discovered working with that and is really beautiful, because it's like we dissociate from what is standing in the way and then can support the healing, and sometimes just having that experience is healing itself, because people get like this break from feeling depressed or being in this anxious place or fearful place, and that this allows them to really feel how it feels without that.
Well, you got to figure if we have an innate balance, an innate compass, that pausing and waiting and resting and taking time are exactly what that needs, right?
Yeah, and this work is also very much about peeling back layers. And when we orient people to the work, prepare them, often describe it as this process of peeling back the layers of an onion. And those layers are all of the stories that we accumulate through our traumas, our experiences with society, the world, what our parents told us, whatever. That stand in the way of that authentic self. And so one of the things that ketamine really seems to do through the process of dissociation is clearing that stuff out, peeling those away. And we often ask people to think about, well, who am I without those stories? Who am I without the depression that I carry around every day? Who am I without my day-to-day worries and concerns? And really getting down to that kind of core sense of self.
It doesn't sound like you're using medical terms. It's kind of sounding more like you're inducing meditation.
Thank you.
And so I'm then curious about, this makes me think about aftercare, because there have been times when I've talked to people and they did a protocol, a series of sessions, and their normal life started to creep back in after a couple of months. And they were like, I don't know what to do. Do I have to do the thing again? I wish there was they experienced this kind of regret that they didn't do more to hold on to the experience when they had it. And is there post work? Because it's like what we do in our circles a lot. We talk about how to post. Is that part of your situation?
Go ahead.
Yeah, definitely. And, so I think there's two ways of thinking about it, because when people are coming in and it's, so there is a difference between the ketamine infusions that are done for depression, where, the research shows for 70% of the people, the depression is lifted, and then they go into this kind of maintenance schedule that they come back for like a booster sessions, anywhere from between 2 weeks and 2 months, and kind of continue to have a benefit. But as our approach with the ketamine assisted psychotherapy is that there is a lot that's coming up during the session. So it's the therapy the client is doing during the time they're getting the treatments, but then continuing with that work. And it is something, what's one of the challenges that we talk about, because people sometimes think about, oh, it's like a magic bullet. Like, I'm going to do ketamine treatment and, I'm going to heal. But maybe the depression is lifted, but there is a lot what needs to be processed. And so it's this kind of overall approach to their health. So it's continuing the therapy, which is, we can go integrating the experiences and processing what came up in the sessions. Because sometimes it's lifelong trauma that people try not to think about and put on the side that's suddenly coming up in these sessions. And bringing the changes, like they might have a change, thought about like, oh, I need to take care of my body more. I want to change how I eat. I, don't want to drink as much. So then it's how do they integrate these changes in their life? And so we are providing them through, support in the integration. Everyone we work with as well has another therapist on the side, like their personal therapist that they're continuing their work with. And if they're coming for the depression treatment, there are these booster sessions that people come back to. So after they finish the initial treatment, they might come back, when they start to feel the symptoms again. And they usually do one booster session. And so far, our experience is that when combined with the therapy, actually the time between the booster sessions is getting longer, so that they don't have to come back every month or every few weeks. So it's not, like a one-time therapy. It's really, we're trying to look at it more holistically, as there is a variety of things. Like ketamine is one part. There is the therapy. There is these life changes. There are habits that people are adopting and doing during.
I think this is so important because as the popularity of psychedelics is having this resurgence and this new market, there's the new people are interested. I get concerned when I see what looks like an abdication of personal responsibility and the desire to just, eat the change they want to see in the world. For that, I apologize. But I worry that, people just sort of, they feel like they got enlightened, or they want to get enlightened and they want to have it all just happen all at once and not do any kind of maintenance or be responsible for actually continuing to live their life in a increasingly improving fashion.
Yeah, and I think that's more of a danger when it's done outside of the setting of a sort of a therapeutic context, and the popularity. And believe me, I'm all for cognitive liberty and recreational use. I don't see that as a bad thing. But exactly what you said. And then when we do this within the therapeutic container, we can orient people to that. We help people to understand it's not just taking the drug and having the experience, even if during that session you feel incredibly enlightened, that's not likely to sustain. And so what other changes are you making in your life? Whether that's yoga or a meditation practice, or simply being more vulnerable. In these states, when people are in a room with us, we're often asking them to be incredibly vulnerable, and supporting that and showing up to that in a way where we can then encourage them, okay, be that vulnerable with your therapist. Take some of that vulnerability into your other relationships and see what happens there. Oh, you haven't felt close to your spouse. And what happens when you are willing to be a little bit more vulnerable with them or your children?
That's beautiful. And so we're hoping that these peak experiences create a new perspective.
Yeah, and I was thinking about kind of when we were talking about before that there has been a therapist, and Dr. Ali Kolb, who has worked with ketamine for many years, and he works differently than how we work. But in his protocol, it's several weeks of preparation, and then there is one time high dose experience, and then several weeks of integration. And for people who come to him, he is asking them to really modify what they're eating, asking for daily exercise, daily meditation, so that, so we don't ask our clients as much, but we hold that as, it is a big thing. It's not something that, you just come in and have this help, and we're talking about it in the preparation of, a lot of things can come up, and kind of the responsibility is like you're taking the medicine, but then oftentimes the medicine asks you to show up in different ways for that. And that you might feel worse before you feel better, and supporting people in that. And, and so as much as we can to support people to integrate these changes and making those changes as they're, moving forward and continuing their treatment and healing.
Do you ever feel like you should ask for more?
You mean asking them to do more?
To do more.
Uh-huh.
To show up.
As well, like I believe it's every person's responsibility how they show up, right? So I can share my experience and what we believe and what we've seen, and then it's the other person how they show up. And I've seen that sometimes I wish like, I would like the person to work on this more, that something opens up and there is like a big experience, and then they want to, put it on the side again. And so that maybe that's the work about allowing that to come up and work with that. So it's kind of like meeting the person wherever they are.
I was reminded when I owned my yoga studio, I sometimes wish that I could have made people do mat rolling workshops. Before they were even allowed to do asana, they had to learn to roll a mat so that it wasn't super pointy at the top. Because how do you expect to align your body, or how do you expect to align your mind, body, and spirit with the divine if you can't align your mat in the basket at the end of class? So I guess maybe that doesn't fly in ketamine assisted psychotherapy. You can't ask that much.
No, you can't. And
you couldn't at yoga either.
Yeah, and I was, as you asked that question, I was like, I'm too busy like expecting more from myself to show up. So I got to meet them where they are. And yeah, whether you're doing this kind of work or traditional psychotherapy, it's too easy and too dangerous to sit here and think, if they would just do this, or if I could just get them to do that. Ultimately, I think it oversimplifies their process.
So what do you do in order? You said I'm too busy worrying about making myself show up more. What does that look like?
Yeah, because I need to meditate more. I need to get on the yoga mat more. I need to eat better. I need to sleep more. I need to, all of those things. So, I certainly try to engage in all of those behaviors as much as I can, because I couldn't do this work if I wasn't, engaged in some level of self-care. But yeah, I'm always feeling like I could do more.
Yeah, and think about it like the set, it's mindset of the client, but it's mindset of the therapist. And so it's kind of how we show up and how we can hold a space that it impacts how the session's going to go. And I do think that even more than in traditional psychotherapy when we work with the medicines. And so what Greg is saying is that we do think about like our self-care and our way of being able to be fully present in the session, to hold a space, and even if they're quiet, to really be there and not travel somewhere in your mind.
Yeah, and I'm in the room with this person who's in a non-ordinary state of consciousness. I have to be aware that it's probably not good if I'm frustrated with them or I'm wishing something else for them than what the reality is in the moment. So, trying to, those are great opportunities for us to practice present moment awareness and just be there with the process as it unfolds.
Am I correct in assuming that you have both spent some time exploring this as well?
Ketamine?
Yes.
Yes.
And what have you gotten out of it personally?
So, so I've had a variety of experience, but the most, profound experience for me was when we were going through the training. So we did Ketamine Assisted Psychotherapy training, where was an experiential part where we worked with both lozenges and intramuscular session. And in the time, I lost a really dear friend, and I was having really hard time wondering if I could, go through the training, if I had space for that. And it has really supported me in the grieving process and helped me, reconnect with him, found more peace and acceptance in that. And so that, has been what ketamine has been a great gift for me in my journey in healing.
My experiences with ketamine started off recreationally. I as well thought, oh, a horse tranquilizer, veterinary medicine, sure, let's try it. Sounds fun. And they were fun. And it wasn't until I was involved with MAPS, and then the research started to come out and information in the popular press, that was 2010, 11, around ketamine, that I was aware that there was another use for it. And then when I started to explore it more professionally, my interest just around consciousness and awareness and being able to work with consciousness, explore consciousness, that's what's so fascinating about the work to me. It's beautiful to see people heal, depression get better, but then I get really excited when people start to move into this space of spiritual exploration and thinking about these greater existential questions, and not from a place of existential angst, but excitement and transformation and transpersonal experiences.
Thank you. That's really interesting. That is that's not something that I ordinarily think of when I associate with, not something I ordinarily associate with ketamine. What do you hope that this kind of work offers, like the community at large, and sort of the medicinal community, and then kind of this psychedelic medicinal community? Where do you think ketamine lies on the map right now?
It's a I mean, like really exciting time. What's happening right now, and you can call it the psychedelic renaissance. And a lot of research, and that has been happening in from the 40s to the 60s, and then kind of was shut down. And so now this reemergence and reevaluating of the healing possibilities of these medicines, and that there is no time that we needed it more as humanity and our planet. And even though ketamine is not a legal psychedelic, it is prescribable for people who need that for medical diagnosis and off-label use. That is something what we can work with now. And so with ketamine as well as other psychedelics, there is this excitement about a possibility of healing. And I believe that there is so much that we need to heal, so much trauma, personal trauma, generational trauma, societal trauma, and so that healing for each person is healing our society, our consciousness, creating more connections, aligning it with our innate values. And so because of that, working with the ketamine is very exciting for us, having this opportunity, as well as the MDMA assisted therapy, and starting the phase 3 and hopefully being able to use MDMA to treat post-traumatic stress disorder, and then going forward other challenges.
Yeah, I guess to that I would add, on the most basic level, we as therapists, we see so many people coming in with depression and people who've tried everything, and the SSRIs, fail or have horrible side effects. And so to have something else to offer people, feels great, and to see people respond to that, and see people get off of other medications. So, sort of on the most basic level, there's that. But then being able to use this also to help people explore their own consciousness, and combine with the other psychedelics. And we haven't touched on this, but even in the psychedelic community, there's not complete agreement on, is this a psychedelic or not. And a lot of people don't consider it a psychedelic. I say, well, you haven't done enough. But I think combined with the other medications that we have, and which will hopefully soon be legal, it's a beautiful tool to have in our kit.
I heard recently that the Supreme Court at some point the Supreme Court ruled that tomatoes were in fact a vegetable. That even though scientifically they were a fruit, that in the common language of the people, they're a vegetable. And I'm not sure if that relates to the is ketamine a psychedelic or not conversation. But what I am curious about is there's this common thought that meds for depression are important because people have chemical imbalances. But when I hear you talk about you can do ketamine, a few times and then have boosters and start to explore your consciousness and sort of unwind the trauma and whatever is, the mental blocks and twists, and have a life that's more free of depression, that conflicts a bit.
Well, it's important to stress that both things are happening. And there was an article that came out, was it in Cell, I think, about the neuroplasticity effects of ketamine. So both things are happening. All of the things that we hoped would happen with SSRIs, there seems to be more evidence to show that those things really are happening in the brain with ketamine. But it also has this other incredible effect of exploring consciousness. And go ahead, Ron.
And I was gonna say that there is not actually one agreement how ketamine works on the brain. There is this communication with pyramid cells, that there is a belief that the ketamine actually allows more communication in parts of the brain that hasn't been happening, and so that people actually then have more energy to take advantage of therapy to make changes. People who have, we'll say just clinical depression from imbalance, there is these booster sessions that help them keep up the results. And so that definitely there is part of the people who this applies to, but then there is a lot of people who come in with depression or with PTSD or with really high anxiety that is so high that they go into depression because the nervous system is overwhelmed. And there is this part where the ketamine works biologically, but then there is this big importance of the psychotherapy and supporting people heal in that way. So that we believe in that way, it can be a cure, that it can help people have the energy and the ability to actually address the issues and look at what they're not looking at. And, we talked on the way here is that there are many people who come in and during the ketamine sessions, they start to talk about things they haven't talked to us about at all. They haven't talked about with their past therapists, with their psychiatrists, because so those are things that are in the past. They're not bothering me. They're not a big deal, and they actually have a huge influence and have been connected with the depression. And it can be, traumatic situations from their lives, or it can be physical surgeries. I had a lot of patients who've got, in having depression, but they have history of many physical and medical trauma that they haven't considered as causing the symptoms they're having now. And then it's coming up and they're processing it during the time they're working with us.
So this kind of goes back to that idea of vulnerability, of being able to look at things in a new way and admit that maybe something's going on there and facing it. Is that even vulnerability? Maybe that's courage.
Yeah, and going deeper and seeing that, that there are parts of us which might be standing in the way, or that it would feel like it's too much to look at, too much to process, and so that the medicine kind of is our ally in allowing us to go there, to be more vulnerable.
Yeah, and I'd say it's also the inner healing wisdom, like, in our day-to-day, very controlled, rigid way of thinking, we think we put that thing behind us, we've dealt with that, we've moved on. We're very big in this culture about moving on. And that inner healing wisdom is like, wait, here's this, you still need to deal with this. There's more work to do here. So again, bringing that up. And then, we encourage that vulnerability to allow that to come up, to experience those parts of the self that still need healing, that need support, that need love, that need to be heard.
This is very contrary to our day-to-day and our cultural wisdom. So it's like dissociate from your role and your status and your place in the world, and instead pay attention to something quiet inside and don't move on and stay with what's troubling you until it gets resolved in a new way.
Sounds like 5,000-year-old ancient wisdom.
Yeah, it's half of these books.
All around us.
Yeah, as well as we are talking, we haven't talked right now about the default mode network, that there is this part of the brain that we use in our everyday life. That's kind of how we deal with challenges. And psychedelic medicines kind of help us connect these other parts of the brain. They kind of quiet down this default mode network. And so that's why these things are coming up. Suddenly, like these protective parts that kind of keeping us away from those parts of ourselves quiet down, and so that this comes out.
What might be some of the other qualities or virtues? What are like psychedelic virtues or ketamine therapeutic qualities, like vulnerability? How else do people grow?
Developing a greater sense of self-compassion, along with that willingness to be vulnerable, is experiencing less fear or less of a tendency to run from the fear.
There can be physical discharges. So there, like that Greg was talking before about a body keeps the score, like that oftentimes trauma is like trapped in the body. So oftentimes we see, that something's like shaking off from the body, or the body's discharging some of things that were held on, reconnecting with parts of the body. So I've worked with clients who had medical trauma, and during the session, they were able to reconnect with these parts of their body that they were kind of didn't feel, or were kind of off limits for a long time. Self-love, self-compassion. And that there is as well this like a window of opportunity for attachment and relational healing, that when this default mode network is not active and these protective parts are not there, and these vulnerable parts come up, there is a possibility of having a different experience. So oftentimes we do, some reparative work, either with the therapist or with between like parts of the patient. Maybe their adult self can reconnect with this younger child or younger self and provide some support. So there is, all these beautiful ways how the healing happens.
Right. That simply comes from a safe environment and an ability to reconnect. That's really nice. What is, maybe we'll take some questions in a moment. Are there any other thoughts that you have on your mind that you want people to know before we open it up for some questions?
I mean, we've talked about this, but just to reemphasize that for us, it's not just the drug. It's really about the ketamine assisted psychotherapy. That focus on the relationship in the room, the integration, how important the integration is. It's not just about that, hour and a half effect of the drug. So.
I'm glad you said that again. I think that's super important. That, the magic bullet mentality.
Yeah, and I do wonder. I guess I have some concerns that as ketamine gets more in the popular press and treatment for depression, that there are going to be more people coming looking for this treatment as a quick fix, and who don't want to do the work for whatever reason. And as Veronika was saying, people can come in for that and then be quite surprised by what does come up. And sometimes these are the people who are so defended and so tied to their current story that when those layers start to be stripped away, that things do often get much worse before they get better.
Right, they didn't expect that they were opening that closet.
Right.
They didn't remember it was there.
Yeah, and we get surprised by it too, and realize, okay, this person's going to need a lot more support and help through this process.
Now, what about, because people aren't going to stop doing it recreationally, but it's my thought that people might try to start self-medicating. Like, oh, it's good for depression, and my friend has some.
Mm-hmm.
Do you have thoughts on that?
Don't do it, but people are going to do what they want to do. Yeah. Again, all for cognitive liberty and decriminalization. But yeah, if people are doing it outside of fun, outside of recreation, then, find someone to work with on that.
It's there's thing about the harm reduction, and that we can stop people from doing that.
Right.
And that there is really big importance what we believe in the relationship and the set and setting. So if people do it recreationally, to get as much information as they can and stay as safe as possible.
Yeah. So chances are you don't extract your own teeth or remove your own appendix. So if it's a major issue that you're dealing with, find someone that can help with that.
That's a good call. So why don't we have a mic and I'll come stand over here, and we can form a bit of a line. Cool. All right. And then Howie, do we have live stream questions too?
We have two questions. One related to how many times a year, and how much time between sessions. Both time related.
Well, maybe you'll come down. Can you come down here with the questions too? And we'll kind of feed you in. We'll merge you in.
Hi.
Is anyone a candidate to do ketamine therapy, or are there some psychiatric diagnoses in which ketamine therapy would be contraindicated?
Yeah, so again, this is all still experimental and off-label treatment. All of the research to date has really focused on depression. So there are certain things that we're very, very careful with. So things like psychosis, schizophrenia, things like that, borderline personality disorder or obsessive compulsive personality disorder, any of these, sort of rigid personality structures. We just don't know enough yet whether that responds well to this sort of treatment.
So how do you filter these people out?
Yeah. So, a lot of people, we do a phone screen first, and during our first meeting with them, we do a very thorough psychiatric intake, just like we would with anyone else. A lot of people come to us also referred by other therapists, so we have that information to go on.
And so there is a medical intake. So there is a psychological, psychiatric, and medical intake with each person who comes, and it's very safe. But there are as well some medical situations where our physician would not recommend a treatment. There are few medications that might be contradictory, so that again our physician talks with the client, and possibly they're coming off the medication.
Yeah, and just to add to that, our main goal as well is to keep people safe. So we have to make that call during an intake. Is this treatment going to be something that would be too destabilizing for someone, and risk their daily functioning? So.
Hi. So this lady and I are the parents of a 24-year-old who's currently going through ketamine treatments. We're trying to, he's having a hard time. He just had his 4th treatment, and he witnessed his own death in the last treatment, and it scared the crap out of him. And so what we're trying to ascertain here is that not atypical? I mean, I heard you say before several times, you said it often gets worse before it gets better. My hit on it is that this fear of his death is the first crack in his rigid armor that he's been holding on to for years, because he's been talking about suicide. So being scared of death, well, to me, that's a good thing. But I'd like to, if you can, elaborate a little more on this concept that many times it gets worse before it gets better.
So yeah, it's not atypical to face one's own mortality, whether with ketamine treatment or any other psychedelic. Very much related to the ego death, and asking those questions of what happens if I cease to exist, and yet there is this consciousness that's aware of the fact that you're having that question. So, what does that mean for what happens after? And near to death experiences are not uncommon. I won't say they're common, but they're not uncommon in this work. And yeah, based on what you said, I think perhaps you're right, that for someone who has been suicidal and has thought about that, to suddenly begin to look at death and their own mortality in a different way is perhaps a crack in that, whether it's a rigid way of thinking or whether it was the escape or the avoidance of, wanting to feel whatever they're feeling or not feeling. Veronika?
Yeah, I just want to appreciate your vulnerability in sharing that with us. And, it's probably obvious, but we can't give advice on someone else's treatment. So it's always kind of going back to the treating therapist or physicians. And, I would have questions like, is he doing ketamine assisted psychotherapy, or is he doing infusion treatments? And so near-to-death experience is one of the possible experiences that people have in moderate to high dose. So the higher dose ketamine experiences can be either near-to-death experience or ego-to-solution transformative experience. And, we can try to prepare clients for it as much as we can, and it's still going to be frightening for many. For some people, it's very liberating. For some people, it's frightening. For some people, it's really helpful in the process of healing. That kind of like what you're saying, that they look at something they were fantasizing about and they're like, oh, I actually don't want that. Like, I want to come back to my body. And so that, that it's kind of about integration and getting support from the therapist there that he's working with. I found this challenging with the infusion clinics where the medical staff have not been familiar with non-ordinary states of consciousness and really didn't know what to do with this came up. So if that was the case and he was, going to an infusion clinic, I would suggest working with an integration therapist that you can find on the MAPS list. Okay, great. Mm-hmm. Yeah, so it's in.
Thank you for this talk. You mentioned I have two questions. You mentioned the current status of MDMA, and so if that were legal or the clinical trials had finished, what is really the difference between that and ketamine, and would you prefer that if it was available? And also, I'm wondering if you've worked with cancer patients.
Yeah, I'd still say there are some key differences between MDMA and ketamine, and even if MDMA, or even when it becomes legal, there will still be a place for ketamine treatment. I think there's some overlap between the two, but there's nothing like MDMA for really opening up that heart space, for increasing the empathy, self-compassion, connection to others. And with MDMA, it's also not a dissociative. So you're able to be very present in the room with the person that you're working with. So there's that.
Yeah, no, I think those are the main differences in MDMA, calming down the amygdala. So, it's not like that there is one psychedelic medicine for every person. When MDMA becomes legal, then, what is this for PTSD, and then there's an off-label use, so that I think it'd be wonderful that one day, hopefully, we'll be able to have, psilocybin, MDMA, ketamine, ibogaine, 5-MeO-DMT to work with, what is needed. So, the similarity is the lower dose. When we use lower dose ketamine, there is this empathogenic openness and state that can be similar to MDMA experience, but as well, it's much shorter. The MDMA sessions are 8 to 10 hours long, when the ketamine sessions we do 2 to 3 hours.
I'm sorry, what was your second question?
Have you worked with the cancer population?
Oh, no, actually, we have not, but there is work going on around palliative care, using ketamine for palliative care, and end of life. So, which I'm very excited about, and hopefully at some point would love to do that work, but to date have not.
Hi. I'm curious about whether ketamine's been used for pain at all. As you were talking about body discharges, and I was wondering if that's something that you guys do or other people do.
Yeah, so ketamine is used in the treatment of chronic pain. but the protocols have mostly been in much higher doses. So it's done in hospital settings. And I've worked with patients who actually were getting this treatment in Stanford, but then they were, coming for psychotherapy. So it's a different protocol, how the ketamine is used and in the dosage and duration. What I've seen with our patients, that there hasn't been like a long-term pain relief, but that people were kind of pain-free during the session, and that was, something that was kind of an additional benefit to some treatment they were having, just having that break from, yes.
And also, I had a slight curiosity about, like, if this does become more popular, is there, like, what's your take on how the availability would be for people to get access to it so it's affordable?
Yeah, so they're working to try and get this approved for reimbursement by insurance, which currently it's not. So, that could make a difference for some people. It's something we struggle with, trying to make this affordable. And at the same time, it is very labor intensive work. So there's the 3 hours in the session, the preparation. We tend to be much more available to the people we're working with than we would with like traditional psychotherapy clients. So there's a lot of, texting and emailing and phone calls, providing that additional integration and support. So it's like trying to find that balance between our time and making it affordable.
And there are a lot of, studies and research now being done to really compare, like, what is the financial investment? Because maybe somebody who suffers from PTSD, they might visit emergency room with panic attacks 5 or 6 times a year. They might be, having a lot of physical symptoms that are actually, connected with their trauma. And so right now, as we are talking, there's, several projects being done in, comparing this. Like, does this therapy that has like a bigger financial investment in the beginning is actually cost effective, and could insurance companies support it more? And we hope that will happen. Yeah.
I think to answer another part of your question, we don't currently do pain treatment at our clinic, but we can refer out for that sort of work.
I have 2 questions. Concerning the long-term effects of ketamine and MDMA, are you worried about that, or how do you take that into account while treating people? And then my second question is, what can you advise for people who are taking ketamine and MDMA without a facilitator when they don't have access to it? I know you mentioned do your research, but I don't see any like facilitators actually giving out actual advice for people to go ahead and do it on their own.
So for the first part, I think that's part of as well educating about psychedelics, to really learn what are the true risks of the medicines, because there has been a lot of misinformation about how psychedelic drugs are addictive or harmful. And so it's different, with MDMA and with ketamine. But ketamine has been proven to be a very safe drug. That it has been used in much higher doses than we'll ever use in our treatment during surgeries, anesthesia, and the pain treatment. And there hasn't been any record of long-term effects. There is a risk of cystitis for some patients. It's a very small percentage of patients, but it is one of the things that has been reported. As well, there is some risk for people who have high blood pressure. So with MDMA, again, there has been lots of misinformation about the long-term effects of MDMA. There is still being, we are in the research, and so we don't have definite results. We are recording all adverse events that are happening. And so as the research is going to be published, we will know more about that. And, there might be some recommendations of how many times it's recommended to use in a year or in a lifetime. But it's too early to talk to that right now.
But yeah, but to date, there are no no proven neurotoxic effects from MDMA. So I know people are familiar, back in the 80s, there were studies showing that MDMA ate holes in your brain and depleted your spinal fluid and all sorts of things. And that was later proven to be very shoddy science. It was recanted. So,
and a lot of the MDMA people use as well is mixed with other medicines. It's not pure MDMA, so it's really difficult. Like when people get pills on the street, what are they really using? And so we are now getting data on when we work with the medical grade MDMA. And to the second question.
Yeah. So your other question is a little more complex. Like, how do you find a sitter or a guide? And I would, be very patient and do lots of networking and talk to people you trust, become involved in your local psychedelic society, go to Burning Man. Yeah.
And I think a lot of the information about, like Aerowic is a wonderful website to get a lot of information. And there are more and more articles now coming out as people are looking for people who can assist them during psychedelic journeys. So in a lot of the online psychedelic forums, there, are just described ways of like what to consider, how to think about it, like what is the purpose, why you want to do that, and how you would want to go about it. And we are excited that when people come to us and they have mental health challenge they're dealing with, that ketamine assisted psychotherapy is something that is available.
Here's one from the live stream.
I combine two together. So this is about timing. So time between sessions on an average. So, and then also the how many sessions per year. So they're trying to get a sense of the timing of it.
Yeah, it's a great question, and it hasn't been clear from what we were talking about. And there is variety of protocols. So I can answer it. If someone's coming for a treatment of depression, the protocol looks like that there are 6 sessions in 2 to 3 weeks. And we're starting with lower dose, going a little bit higher depending on the response of the person. And then they would have a booster session when the symptoms start to come back. So for someone, it might be after 2 weeks. For someone, it might be after 3 months. So there is no limit on how many sessions person should or shouldn't do in a year. And there are a lot of protocols. We are in several consulting groups with other therapists who are working with doctors providing ketamine-assisted psychotherapy, developing protocols for people with PTSD, anxiety, attachment trauma. And so for someone, it might look like a very low dose once a week for several weeks to months. For someone, it might look like having a higher, maybe 1 or 2 sessions that kind of deepen their therapy work, and then it takes months to kind of integrate and work through what came up. So there, the one I said in the beginning, that is the protocol for treatment of depression, which is similar to the infusion clinics and to the work we are doing.
And 3 quick questions of a more technical nature. When you're talking about ketamine in your work, do you mean the hydrochloride? And do you mean the racemic mixture or the S-ketamine? And if you've had any experience with using both, maybe comment on any differences you've observed. And then just taking the 4 main routes of administration, say IV, intramuscular, subcutaneous, and some sort of oral insufflation route. What are you talking about when you talk about a full dose? And I do realize there will be ranges there. And any comments where you've used different methods with different people, perhaps?
We should have had you moderate.
Yeah, so it's we don't work with S-ketamine. We haven't had experience working with that. We have some colleagues who are working on a research for that use. So it's HCl, and we use dissolvable lozenges. and intramuscular injections. So those are the two routes of administration we use. With majority of people, we start with the lozenges. There is a compounding pharmacy which makes these lozenges for our doctor. And they can be done in variety of strengths from 50 milligrams to 150 milligrams per lozenge. There is a difference, we're asking technical, so there is a different bioavailability. So in the intramuscular injection, there is about 96% bioavailability, while in the lozenges is between 30 to 50%. As well, it's a weight dependent. So, somebody who has lower weight might start with a lower dosage than someone who has higher weight. But we usually start with a small one lozenge weight. It takes about 20 minutes before the person feels the effect, and then see how they're doing, and they might use the second lozenge or third lozenge. With the intramuscular sessions, we will use only with people who have had the lozenge experiences before and had a good response. It might be useful when somebody needs to use higher dosage. So we will not use more than 300 milligrams in lozenges, so no more than 3 lozenges. If somebody needs that much, we would go to the intramuscular administration. And then, depending on the protocol, so someone who we work maybe with the attachment trauma, we will use just lower dose lozenges. If we just want a little bit of the protective parts to come up, and we're doing a lot of talk therapy. While with the depression, we might go to the more moderate dosage. The high dosage so high dose is considered like 150 to 200 milligrams intramuscular. The low dose would be like 30 to 50, and then moderate between 50 and 100.
It's really fascinating in this work too to see how different people respond to these different doses and different routes of administration. There's a pretty good amount of variability in how people respond. And so we have to, work with that and learning about that person's, their rate of metabolizing and those sorts of things to figure out how to best work with the medicine with one particular person.
I'm sorry, you've mentioned attachment therapy a couple of times. What exactly is it? It's just a segue.
So there's a question about attachment therapy. What am I referring to? Yeah. So that would be someone would call like developmental or attachment trauma. So it might be early trauma, maybe somebody, being separated after birth, somebody being sick as a little child, being separated from their parents, or somebody having parents that were not available, that they were not responding to their needs, so that the person didn't develop safe attachment, which means that they feel, secure in their relationship with their caregivers.
Another question that came from our online listener was ketamine therapy used for the treatment of alcoholism? If you could fill us in.
Yeah, yes, it is being used for that. We don't actually do addiction treatment at our clinic, but yes, it has shown great promise for treatment of alcoholism and potentially other addictions as well. Again, because there is no patent on ketamine, getting enough research going to show exactly what it's effective for and what it isn't effective for is a real challenge. Drug companies are willing to put up the money to do the research. So there are groups of us who are doing this work, who are collecting our own data with the types of patient populations that we see in order to build some body of research to show what works.
Hi, thanks. So I have just kind of a general question on a topic that's come up a couple times about recreational versus sort of this applied use of ketamine. And so it's kind of a question of like the form of intake, like snorting a powder versus like laying down in like a controlled setting. So there's that ingestion piece, and then also just like the experiential piece of difference, because I personally haven't had a ketamine assisted therapy experience, but I've had extremely like therapeutic healing experiences using it on my own, and have found myself pulling on like my resources with meditation and mindfulness and all the other spiritual and grounding work I've done, as well as feeling like more dropped in and pulled into a meditative and like healing awareness space. And I've also seen people like having very different experiences with ketamine than I've had. So I'm just kind of curious about like why it's been such a positive like healing, like balancing thing for me, and maybe for some people not, and how that kind of interfaces with a more applied use.
I think precisely because you have those tools and you have that developed practice to use during this non-ordinary state of consciousness. And that applies to whatever medicine we're working with. When people come into the work already having some foundation like that, they're often starting like steps ahead of someone who comes in with no awareness of grounding, of mindfulness, of meditation. So, I think when we talk about this from a harm reduction perspective, I'm most concerned about people who are like, fuck yeah, let's get high. And, they don't have any kind of grounded, any tools to work with. And then they find themselves in this like, their head blown apart.
Disorganized experience.
Yeah, very disorganized. And there's rarely anything therapeutic about that. It's just trying to claw your way back to the surface.
At least you survived.
Yeah, right. And, hopefully then that feels like, okay, maybe now I can respect this and, maybe I'll try that again. But then we hear from people who like, no, I'm never doing psychedelics, I'm scared to death of ketamine because of something like that. So just always, urging caution.
And in terms of the ingestion piece of it, like what is different about the experience a person has from intramuscular versus like the lozenge or nasal ingestion?
Yeah, ultimately it comes down to, as Veronika mentioned, the bioavailability. So, yeah, insufflation or snorting it works just as well. And, you can certainly get to a therapeutic experience, therapeutic dose. And there are formulations of same compounding pharmacy. They do nasal sprays, which are ketamine suspended, and saline, which are used in treatment as well. We don't use it in that formulation in our clinic, but yeah.
One more from the webinar.
This is a kind of an interesting question, and I think you'll enjoy it. They were saying that you guys were saying there was somatic release from the use of ketamine, and the person on the listening end said, well, if it's a dissociative, how is that so? And this is a good precautionary piece because there is movement, but you might share some of what you experienced with that.
Yeah, so it's a great question, and it's something that I talked about a little bit before, because there is this dissociation. We've seen that it's dissociation from these protective parts. So something what's maybe stopping that movement to happen. So people, it's a kind of how people can describe it. It's kind of feeling out of their body, or feeling a little bit numb, or feeling like, when you're leaving a dentist and your cheek is starting to wake up, having that kind of feeling in their body. But in the same time, they might be really aware and in their body. And so we've seen a lot of movements where trauma has happened, like in their, hands, legs, in their jaws. And, I would say maybe it's like 10 to 20% of people who've had trauma who have this type of release with ketamine. And, I explained it that it's kind of dissociates these parts which are stopping that from happening.
In my experience, there was people like flying, feeling like they were flying, so they had to kind of be protected around the physical body. So they hit somebody, put their hand through glass, or so to kind of protect.
Yeah. Yeah, people can be dissociated and quite active at the same time. Yeah. And there is some relation to the dose as well. At the lower doses, maybe there's more of that experience and feeling in the body. At the higher doses, a person tends to be much more anesthetized.
And so you consider those to be somatic releases of trauma that's been built up in the body over time?
So there can be, there are two different things. So one can be movement, right? If somebody's like feeling in their body and want to move and stretch out, which would, be probably on the lower dose as well. While that, there can be some releases in the body, in the nervous system. So there is, it comes from somatic experiencing. It's Peter Levine's work, where oftentimes the trauma can be trapped in the body. And one way of releasing it is that the body starts shaking by itself. And so I've seen that in therapy without ketamine, but then witnessed it with several of my ketamine assisted psychotherapy clients.
So I know that you guys are just fresh back from the World Bufo conference in Mexico, where there was a lot of talk about 5-MeO DMT, presumably. And then in the videos that I've seen of that, there's also a lot of movement by people that don't seem to be particularly conscious. Can you relate those two, or do you have any thoughts on that as compared to the movements that you're seeing in your treatments?
This is purely, I think, conjecture and hypothesis on my part, but yeah, there is certainly some connection there in what we see and the way that, a lot of people come to the work, the Bufo work or the 5-MeO work with a lot of trauma. And, it is such a powerful transformative experience that so much gets released and so much can get processed that there is a physical expression of that. So.
I have two questions. The first one is, I think I can envision a day when there's maybe a pre-counselor that could help you, like say, hey, had a little attachment trauma, it's not ruining my life, it kind of comes up in some relationships, it's work, I'd like to get through it if I could, and some anxiety, and really interested in this consciousness expansion thing, what should I do? Is this for me? How do I decide if this is for me, or should I look into MDMA, or is it DMT? How do you decide, or what's a process you would offer to us to decide if this kind of thing is right for me? And then also, this isn't the second question, this is part B of the first question, but how much investment, is it, obviously if there's depression or PTSD or something serious like that, you're gonna fully invest. But if it's kind of more borderline, like, is this right for me? Is it this full-on investment of a full course of treatment that you guys do, or is there a, maybe go to MAPS and look for a sitter and do something a little low, you know what I mean? How do we go about making those kinds of decisions today before there's, more support for all this stuff available?
Yeah, let's spend a few hours sitting down talking about it. And the hypothetical world where all of these things are legal and available, then I would spend a great deal of time sitting with the person to figure out, based on what they're searching for, what they're struggling with, or what their goal is, what medicine might be most appropriate to help them make that decision. And my job would be to provide as much information as possible to help them make an informed decision. And not people do come to us, looking for a variety of different types of work. Now, legally, there's only certain things we can offer them, or to enroll in a study. But I often spend a lot of time, cautioning people to slow down. What is it really that you think you're looking for? And in our, might not be the most wise thing to immediately jump in to a powerful psychedelic experience. But, to really get a sense of how how prepared are people for this?
Yeah, this is just kind of like what you're saying, and that, I would not specifically recommend someone to do any type of medicine, that it's kind of giving as much information and experience we have, and then trusting like the inner healing intelligence of the person, that they're called what is right for them, what is their path, and really asking all these questions, what you're saying. And unfortunately now we're in a place where it is not legal, and ketamine is legally prescribable for people who have mental health diagnosis and are struggling. And so unfortunately that for someone who's like, oh, I have like a little bit feeling like I would like to try it, it's not available at this time here.
And if people don't have access to sitting, it'd be great to sit down and have a conversation with you, and everyone could have an opportunity to do that. That would be ideal, of course. But if we don't, or if one doesn't, then my question was kind of more, how does one go about these days? I mean, do you direct them to Erwin or MAPS, or is there some other?
Yeah, there are multiple sites now listing integration therapists. There's not just MAPS. So Googling psychedelic integration, will bring up multiple resources, and most people offer video sessions as well. So you can schedule time with someone without needing to show up in their office. And this question comes up a lot. People, a good deal of my work is around integration, helping people integrate experiences they've already had. And the tendency is to often want to, speed through this process and rush this process. And oftentimes my role is to have people slow down, get quiet. Let's work with what we've got here before we go out and, accumulate more experiences and crack open even more.
Gotcha. And this second question, a bit more general. Not ketamine specific, but psychedelics in general. Kind of how do you see this maybe playing out? Just listening to KPFA on the way over and talking about these horrible situations happening at the border, and people running from terrible conditions and not being let in the country, and they have nowhere to go. And all these things that are happening in our society right now. How do you see psychedelics shifting that in a realistic kind of way? I mean, can we really make inroads on a individual level, of course, but can we really, is there some way to take it up a notch for societal impact on these huge challenges we're facing? And if so, what might be things that we in the audience could do to assist that in happening?
Spend money and time giving to causes for sensible drug policy would be a good start. But to the other bigger question, Veronika. Yeah, I don't know. I don't know the answer to that, to be honest. And that's something that I certainly think about. And at the moment, yes, all I can do is stay focused on the individual work that I do and my own personal work and my own personal practice, and what are the small things I can do, and have great hope for humanity and optimism for the future despite how bad things are now. This gets to, I guess, my personal beliefs, but yeah, that this is the shadow right now that really needs to be exposed so that we can address it and we can work with it, and that it will ultimately get better. We will come out of the other side.
And just as well, like how can we be engaged and serve each other and the planet? And that, for me personally, is this, psychedelic activism, education, working in the research, talking about it with people, getting more awareness. And, I do believe that once these medicines are more available, that we start to heal, feel more connected to ourselves, our purpose, connected to other people, and that a change, moves beyond individual or small groups. And so it's really like being engaged in whatever you're passionate about.
And I think, it is moving beyond the individual. Daniel just mentioned this conference we came back from in Mexico. And, last year there was the Psychedelic Sciences Conference, which had over 3,000 people. So, these conversations are happening and, it's slowly being disseminated. Well, it doesn't feel so slow at the moment. It feels like it's happening rapidly, particularly after Michael Pollan's book came out. But yeah.
It's like a bull market. One of the things that came to me, thank you for taking all those questions. One of the things that came to me when we were talking, when the idea of 5-MeO-DMT came up, is the importance of finding someone to work with that is kind of safe and sweet and shares one's values. There was some controversy, right, in the Bufo community about practitioners who are very rough and not particularly gentle or kind or respectful of their clients. And the question that comes up is, what do we do about that? And then I'm sitting with you guys and I'm getting the feeling that like that's not your MO, that you do things in kind of a different way. And sort of how you were talking about, like, oh, I'm busy working on how I can be the most present I can be. It's like, how do you see, your role as how you hold space as being part of that line in the sand?
Yeah, I think of this very much as a birthing process, and that my role is in some ways like a doula. And do you want a rough, reckless doula, helping you come through the birth canal into this world? Or do you want a lot of support and gentle guidance and, and love and presence? So, that's kind of how I think about it. And, not every client is easy to work with by any stretch, but, my job is to love them and support them.
Right, and I think it's the safety and respect and, that it's what the client needs and what they want, and they agree to whatever's happening in our session. So that is, our value and really the inner directiveness from the client. And what do we do with, other practices? I think it's sharing our experiences, sharing our beliefs and challenging, and bringing up questions to people who work differently, who are not providing that support. And, here it's going to be like showing data, collecting data that we are doing. What is the difference when we do therapy and we hold a space in the way we are doing?
And I think that might be there's something nice about the legality of it and the fact that there's access and people can kind of take you or leave you or go to the person down the street. That almost requires a different level of integrity, and I'm sure you would be integrous regardless. But what I mean is that I sometimes see that because access is such an issue, that people have a tendency to just take what they can get, even if it's maybe from a guide who doesn't hold space in the same way.
Sure. Yeah, I don't know if that was a question, and I don't have an answer to.
It's just a conversation.
Yeah, and it saddens me, and of course we know about those facilitators, and we hope that by being more present as a community and by being supportive and also meeting those people with love, that we can sort of nudge them in a bit more of a gentle direction.
And thinking about it, that we're thinking from the point of scarcity, like not being enough or not being able to find a medicine or the facilitator or clinic, like a lot of places around the US, they're not, even ketamine assisted psychotherapists, but there is. It's like our mental health, our well-being, and how can we say no to what doesn't feel right? That I do believe that it will open up space for what's right to come up, and for us to be able to find that. Like if we accept something what's not good enough, or it's somewhat good enough, then we are not open to the opportunity to finding what is really what is the most self-caring and supportive.
We're not listening to our inner healing wisdom. So I'd like to thank you very much for coming.
Thank you for inviting us.
Thank you.
How can people find you?
Not on Twitter, not on Instagram. Our ketamine clinic is Polaris Insight Center. And we're located in San Francisco in the Castro. So we both have a lot of business cards with us if people want those. I'm happy to pass those out, and you can contact us if you have additional questions. Try to answer emails on a timely basis. But yeah, happy to answer any questions that people have.
Excellent. Thank you so much. And thank you all for coming. And we hope to see you again.
Thanks, everyone.
Thank you.
I'll let everybody know you guys are welcome to hang out as long as you want. This is KT. We got your back. Whatever you need, anytime of the day. We love you. Hang out. Bye.